Using vitamin C to combat a cold, turns out, doesn't work. Our next guest has the truth about cold cures that you need to know. Spit out the OJ, pulp or not.
Somebody give me a doctor. You better call up the ambulance. I'm deep in shock. Oh, Lordy, baby.
Well, the average person suffers 3 colds each year, but the truth is the cash you're spending on over-the-counter remedies may be one big waste. So what's the best way to get some relief? Joining us now with the cold, hard truth is Dr. Devi Nampiaparampil. She's an assistant professor at the NYU School of Medicine. We're glad you are back.
Oh,
Let's talk cold. So that's a bunch of time here. We're talking 9 to 14 miserable days that the majority of Americans are facing each year with the cold. We're going to go through some common remedies and see if they work or not.
Sounds good.
Let's start with decongestants. What's your take on that?
So those do work. So those are drugs like Sudafed. The way they work is that they decrease the blood flow to your nose or to areas that develop a lot of mucus and congestion. So they narrow those blood vessels, and that helps you stay a little bit drier so you don't feel as congested. Now, the danger with that, though, is because they do narrow the blood vessels, if you have high blood pressure or something like that, they can also increase your blood pressure by decreasing that width of the blood vessel.
So you should still let your doctor know if you're taking
Yeah, or you can switch to sprays, nasal sprays.
Okay. What about vitamin C? Everybody gets sick, they go grab vitamin C, the little packets or drinks. What's your take on that?
Unfortunately, vitamin C is not as helpful once you already have the symptoms. You know, vitamin C is a good thing to have on board just in general because it can boost your immune system. But once you get sick, unfortunately, it's not as helpful.
Okay, so build up the supply of the vitamin in you before you get sick, and it may indeed help, but not in the moment. Expectorants.
Expectorants are not that helpful. So here's the irony. There are 2 types of cough medications. There are cough suppressants and expectorants. So suppressants help you manage that cough and basically help with your symptoms. That's the thing that you want to take before you go to bed. Expectorants actually make you cough. They're supposed to clear out your throat or clear out some of the congestion. But for most people, that just makes the symptoms worse. And it can be confusing because they might have similar names. Like Robitussin is an expectorant, Robitussin DM is a cough suppressant.
Oh, so really pay attention to that fine line there in detail. By the way, if a cold if it's accompanied by a fever, do any of these things help, and what should you do?
Well, these can help, but if you have a fever, you really need to see the doctor. So we're talking about a fever of 101 on average. For some people, if they have more symptoms, they should see the doctor earlier, because a lot of times when you have a cold, you can get a bacterial superinfection, and those can be really dangerous and life-threatening.
Okay, antihistamines. Sometimes people deal with the cold for a long time, nothing's working, they don't have a fever. Is this something they should consider?
Yeah, so especially if somebody has a cold that's been lasting for more than a couple of weeks, even before that, you might try it. These are things like Allegra, Zyrtec, Claritin. They're usually for allergy sufferers, but what happens in some people is they get the cold virus and then it triggers an allergic reaction or allergies. So they can have the same symptoms, runny eyes, runny nose, sore throat, cough, and people might not realize what they're really battling at that point is allergies, not the cold itself.
Okay, Dr. Devi, we thank you for drawing the line between what works and what doesn't when it comes to the common cold. We'll see you soon.
Thanks for having me.
Stay healthy, too.